Welcome to my podcast. Today I'm going to talk you through erectile dysfunction. It's one of the cases which show up in Lab 2 station. So the patient will come to you and he might be a little bit embarrassed because it has to do with intimacy. So the patient will tell you that I couldn't do the job, or I can't finish with my partner, or I'm having problem with my erection. So you need to inquire if it's painful or not, because by this you are ruling out Peyronie disease, for instance, which is due mostly to scars and could cause too much pain. You need to inquire about history of trauma, and you need to ask if it's something, a recent one or since some time. And you need to ask if there is any morning erection at all, and ask the patient if when he gets excited or stimulated visually, does he have any erection? Does he feel anything? Does he have any hardness? You need to ask about swelling, pain, redness, discharge, any sexual activity outside marital status. You also need to ask the patient if he's under stress, under anxiety, if he's depressed, or having taken any illicit drugs at all. Also inquire about the level of alcohol intake and smoking. And also you need to ask about any surgery, for instance, or any trauma locally. Also inquire about the way you dress up. Sometimes some patients, if they are dressing all the time in tight underwear, it could affect as well. Cycling could be related in one way or another. Also inquire about history of any heart disease, antipsychotic medication, because they are well known to cause this problem as well. And also ask if the patient have any thoughts that might be the reason for this problem, and if he is in any new relationship, for instance, or if he has any desire or interest in making love, for instance. And also you need to ask about the patient if he had done anything at all to tackle the issue. Say, for instance, they might refer to certain, vacuum user or any of that, just to elevate the issue. So all of that need to be addressed. And also, you need to, after taking the main history, and after asking about the eye sting, you need to have the patient examined. And of course, you have to have a chaperone. So you need to explain to the patient and say that I would like to examine you with the presence of the chaperone, and are you happy for me to proceed? After then, you need to agree about the management plan. So basically, you will send for certain blood tests, for instance, like full blood count, liver function test, uroelectrolyte, creatinine, thyroid function test, blood cholesterol level, and also the male hormone, testosterone, and prolactin. And you can send also for urine routine test. And after that, you need to ask about the patient routine and habit, for instance. What sort of food does he eat? And how frequent, for instance, he perform with his partner? And did he tried any of the market pills, for instance, like the blue tablet? So all of that need to be covered as well. And then you can suggest, for instance, certain ways to tackle the issue, for instance. So basically, if the patient didn't try the blue tablet, you could suggest that as one of the things, but you have to make sure that the patient doesn't have any underlying heart disease or MI. And also you need to suggest, basically the main things that we can use, for instance, like there are certain devices which can be tried as well, and to see how it goes. I forgot to mention that you need to ask in the past medical history beside, high blood pressure, diabetes mellitus, if he has any genetic problem, about the organ development, if it's normal, or hypogonadism, for instance. All of that need to be kept in mind. Of course, sometimes it's something to be faced, but it's something we don't need to miss, for instance. So that's basically, in short, about erectile dysfunction. And it could be sometimes only it's emotional or stress thing, which can be tackled. So you could agree about the management plan with the patient, like, for instance, send them for counseling, CBT, so it's cognitive behavioral therapy, to address the patient's main concern about his sexual feeling, sexual functionality. So all of that to be considerate, and then you can take the measures further accordingly and according to the blood test result. So I hope by that I covered the main point for erectile dysfunction, and hope you enjoy the podcast. Thank you.